Starts off with an experience that you had with your dog, and that proved to be the lemons from which you made this lemonade. But tell us what happened with your dog.
So, I was just to give you the setting, I was a new mom. I had a newborn and I think a 2.5-year-old at the time, and we had already had our golden retriever for about 4.5 years. He was my firstborn, so to speak. And beautiful, healthy dog. And at around 4.5 years of age, he became sick. And, you know, golden retrievers, he eats everything, chews everything, pulls everything off everywhere. We thought, oh, you know, he probably just had a sock, you know, chewed something, and we took him to the vet. And he was icteric, so he had yellowing of the inside of his ears, and it turns out at that moment we found out that he had what was called autoimmune hepatitis. So his immune system was actually attacking him at his liver, and we really didn't understand or know this. We didn't even know dogs could get this kind of diagnosis. We know in humans, of course, and I'm an autoimmune disease doctor, so the ironies really run deep in this situation. And we ended up taking care of him for about 6 months using all the human immune system suppressing medications. And he eventually succumbed to his illness, but it was just an eye-opening and heartbreaking entree into the world of environmental health, because I was, you know, at the time knew nothing about chemicals, nothing. I was eating Cheese Whiz, Oreos. I mean, I was just really not really into the idea that environment affects human health or pet health. And so that was really the entree into understanding that there can be exposures that can turn the immune system, trigger the immune system onto itself.
And here you are acting as a rheumatologist, dealing with autoimmune conditions in humans, and basically working to treat the smoke, not the fire. I mean, let me characterize it as you were doing your best to calm the immune system down, but had not yet realized that we should, or it might be worthwhile to consider what might be compromising the immune system in the first place. So that was a real eye-opener for you.
Yeah, but it was interesting because having had the training in autoimmune disease up until that point, you know, it was kind of putting together this background of information of why am I also seeing so many new autoimmune disease patients? Why are they coming in younger? Why are they coming in with less family history that you would expect for a diagnosis of some type of autoimmune disease? So all these kind of training background information kind of was colliding at once. And I think that's why I was particularly intrigued about this particular situation with my dog.
As it so often happens, I will tell you a brief story that both of our Wheaten Terriers died of large cancerous tumors. And we realized that the park where we were taking them for a walk was really quite toxic. And, you know, we puzzled over it as well. What is it about a dog? You know, why would they be dying of cancer like this? And it was very challenging. I mean, I think back to reading your book that you were actually tapping the ascites fluid. You were drawing fluid out of the abdomen around the liver to keep your dog alive at one point.
Yeah, well, my husband and I are both, I mean, I'm obviously a physician, but my husband's a physician also. And, you know, there's not enough of a, I would say, an establishment around helping animals at this chronic stage, similar to humans in many regards. And we really wanted to make him comfortable and extend his life out in the most comfortable way, the way you'd think of your favorite relative or best friend. So we really just treated him conventionally, steroids, you know, and appropriate pain medicine if he needed it. But essentially the fluid that builds up around a liver that's not moving fluids as it should, right, blood and fluids, you know, gets stagnant, can back up, and that's where you get pressure and ascites and different changes in the vascular system. I mean, it's just plumbing, really. And so what we did was, you know, the vet, who was very, you know, warm with us and really was just heartbroken with us, he taught us with the ultrasound, you put an X on the belly with, you know, a marker. And at night, after we put our babies to sleep, you know, we'd go into the kitchen and we'd literally stick a long needle in, sterile needle, and we'd draw off, you know, upwards of a gallon of fluid off of this baby's, you know, belly. And it would relieve him and he'd be much more comfortable. And we just kind of waited out to see how far we would go with this to, you know, not leave him in any discomfort.
So that tragic experience for you. Really, the bright side is it led you to realize that so many things in the environment, I think it was his play toy that you became suspect of, and other things, the flea and tick stuff that you were putting on the back of his neck that we were all told is a good thing to do. You know, what is so compelling about the first part of your book is the incredible number of chemicals that are in our environment to which we are exposed daily. But beyond that, the virtual complete lack of regulation. So tell us about how you discovered that and what it was like when you finally had that moment where you said, my gosh, there's no regulation of these. Because we all assume when you buy a product, well, I'm sure some administration has looked at it, made sure that it's safe for me to use on when I shampoo my hair, or lotion for my skin, or sunscreen. But the reality is that's not happening, is it?
No, and I think what was really heartbreaking, in addition to making me angry, was that I had never learned any of this information in medical school, high school, medical school, college, pre-med classes, residency, even in practice for, at that point, about 10 years. And, you know, I really, because I had not learned it, similar to integrative medicine and functional medicine thoughts and practices, when you haven't learned it from teachers you respect and in environments that you respect, you sort of don't believe that it exists or it's real, or, you know, that there's other tools out there. So when I was, you know, trying to think about his food and whether or not his food might have been contaminated to make him sick, or the flea and tick collar that we would drip on the back of his neck because we were told to, we live on a farm in New Jersey, and so we have glyphosate sprayed literally outside our back door. I mean, this is what I'm also currently battling. You know, and when you think about all those different types of exposures that he's around, even our children are around, if you think about it, you know, it called into question, you know, is there something wrong with this? And as I started looking up, you know, whether or not pesticides could cause autoimmune hepatitis, or plastics and plasticizer chemicals, like the toy that he always had in his mouth. I mean, this was unusual how often he kept it in his mouth. You know, it started to peel away these questions. And when I would look around the kitchen, and at that point it was just me and my cat, more or less, I would say, is this true? Could this possibly be true? And I would reach out to the people that I knew were in this environment, environmental working group. Certainly I was getting quite a bit of information from them at the time, even back then. And I started to ask questions, and that's when I really reached out to them and said, listen, is this stuff true? And they said, not only is it true, you're one of the first doctors that's reached out to us, because I was giving community lectures on what I was finding. They said, let's work together and let's bring this to hospital systems. And that began a 2-3 year journey with them. But really, I created a CME program for hospital grand rounds departments across the country to try to educate them on the effects of these chemicals that we now know, called endocrine disrupting chemicals, and what they do, and break it down into classes for large university hospitals. It was remarkable.
So let's just unpack that term, endocrine disrupting. I mean, we understand that there's a lot of attention in terms of estrogen mimetics, estrogen receptor, things that will work both antagonistically and agonistically with respect to various receptors. But let's unpack what you're talking about when you're talking about endocrine disruptors.
So endocrine disruptors has been coined as the overarching name for chemicals, and there are a variety of them, that have this uncanny and kind of worrisome ability to disrupt. And disrupt is a broad term because it can mean, as you mentioned, it can mimic hormones, which are basically chemical messengers in the human body. It can block them, and it can also work on the receptors, which is where these chemicals are delivering their message at the end organ or end tissue. And so there's lots of different ways that it turns out these chemicals can in fact disrupt the normal workings, the normal physiology of the human body. But we're talking very, very, very low doses, the way hormones work. Because over evolution, you know, through millions of years of evolution, we've conserved energy as human beings, and we have hormones that message very important physiology through very small amounts. And that's exactly what these chemicals have the capability, and different chemicals have different capability, but the evidence is robust, it's international, The World Health Organization has a 4-inch thick paper basically describing this global onslaught of chemicals and how it's affecting endocrine disruption. And of course, the American Academy of Pediatrics, the Endocrine Society, the American College of Reproductive Medicine all have their position statements. So this is a real topic that has gained a lot of traction, especially over the last 5 years, 5 to 10 years.
אתם צופים ב-Dear Dog Live.